This news broke this week, and it's not being discussed nearly enough. This is kind of absent on mainstream media, but thankfully there are some alternative media outlets that are covering it, and some print outlets are doing a good job here. But healthcare insurers expected to raise premiums by as much as 40% to recoup coronavirus losses. Insurance companies may respond to cost increases as high as 21% by hitting individuals with 40% premium hikes. So, I could already hear the market fundamentalists saying, well, actually, you don't understand exactly why we have to do this, because when you look at the numbers and you do the math on it, obviously, this is something that's necessary because see that where this line and this line meets on the graph? God, the market fundamentalists are the worst. It's so annoying, like hearing them go off about stuff like this. But I got news for all of them. There's a former VP of Cigna. I think his name is Wendell Potter. And basically this guy saw the light and he realized, like, oh my God, I'm part of one of the most immoral industries of all time. And he realized, wow, the role of the company I work for is to deny as much care to people who need it as possible so that we could pad the bottom line and make more profits, which we have a fiduciary responsibility to our shareholders to do. So you have this guy with this enlightenment moment. VP of Cigna had an enlightenment moment. Oh my God. And he felt terrible. He's like, I can't do this anymore. So he's no longer in the industry, but what he does is he exposes them ruthlessly. And so he came out and he said, no, this is what they're doing here is robbing people. What these premium hikes would do is they'd be robbing people. So he explains that they're going to skim on COVID treatment as much as possible. And then on top of skimming on the treatment, they're going to jack up the premiums. And even though they tell you, oh, we're financially hurting so much, it's actually not true. So their stock prices, since the beginning of the crisis, their stock prices for their respective health insurance companies, they're up 5% to 15%. So they're not taking a big hit. It's going in the other direction. Now, the CEOs for these companies make anywhere from $10 million to about $25 million per year. The big insurance companies raked in about $10 billion in profit in one single quarter in 2019. $10 billion in profit in a single quarter in 2019. So the point from Wendell Potter is like, they're going to tell you like, bro, we have no choice but to jack up premiums 40%. That's total nonsense. They're robbing you is what they're doing. And listen, honestly, you shouldn't be surprised by this. Why? Because I've explained it 1,000 times. They're a mafia. What's the point of health insurance companies? What's the point? So you have an unnecessary middleman between you and your doctor. You pay this middleman every month in case something happens to you. And then if something happens to you, you go to the middleman and say, could you help me out? And the middleman's like, well, yeah, I mean, I'll help you out, but you got to cover the first like $3,000. I've been paying you every single month for years, and now I finally need you, and you say, yeah, I got you, but first. What do you mean, but first? But first? What are you talking about, but first? I've been paying you every single month for years. You pay is your whole point. Well, see, what happened was the sun was in my eyes, and we got to make sure that the mathematics and the numbers on the screen, it doesn't add up properly, so if you just shut up and pay $3,000 first. Premiums, co-pays, deductibles, all that stuff. Don't take my word for it. Take the word of Wendell Potter, the former VP of Cigna. It's all a ruse. It's all a scam. They are an unnecessary, for-profit, rapacious mafia middleman that gets in between you and your doctors and price gouges you and robs you. Now, just so you understand, all the other countries, they don't face this. Every other developed country on earth has one version or another of a single-payer system. There's no fear. There's no concern over there about, oh my God, we have a health crisis, sorry, but you're going to have to pay so much more in taxes next year for your health insurance. That doesn't happen. We just got done. How long ago was it? A week ago? 2 weeks ago? Talking on this show about how they decided, oh, we're going to dump $1 trillion into the financial markets to shore them up every single day. Every single day. Every day. Every day during the crisis, $1 trillion. $1 trillion. $1 trillion. $1 trillion. They did the, $4.5 trillion bailout bill. They throw around money like it's, no, we have to do it. It's a crisis. It's a matter of necessity. Don't worry about how we pay for it. So why is the same approach not taken for healthcare? Sorry, but we're going to give you treatment that's not even the best treatment. And then on top of that, we got to jack up your premium 40%. So the financial markets get an unlimited amount of cash, but individuals who got the virus are getting not the best treatment, and premiums are getting jacked up. Everybody's premiums getting jacked up, not just the people who get the virus. Everybody's premiums getting jacked up. If this doesn't wake Americans up to this scam, nothing will. And actually, that's not fair because the polls already show people want Medicare for all. They already show it. But we're not getting it, and we're also not electing the politicians who would deliver on it. But this needs to wake people up, man. This needs to wake people up. And honestly, shame on our lefty leaders for not using this to get certain things implemented. I think a UBI could have been implemented during this crisis. I do. I think the corporations would have handed over a UBI, $1,000 a month, indefinitely. I think they would have done that to get their precious bailout money. But instead, we got a one-time $1,200 payment because I don't think our lefty leaders were strong enough in negotiating, and Bernie Sanders should have said, I'll hold up the bill until you give more. I'll hold up the bill until you give more. But see, this is what happens when you have the mafia middleman running our health insurance and our health care system. This is what happens. So, whoops, sorry, 40% increase, we totally have to do it. Don't trust the former VP of Cigna who says we don't have to do it. He's not true. He's not right. He's not right. He's not right. Well, as a matter of principle, why should there be profit made in such an endeavor as health insurance? I've never heard a coherent argument that makes sense on that front. Listen, I'm not a hardcore socialist or communist where I say the profit motive in all industries must be gone. I don't agree with that. But I certainly believe that in certain industries, the profit motive shouldn't be there. And one of those things is health insurance and healthcare. Why should there be profit in that industry? All the evidence shows that that's a wasteful, costly, inefficient system that delivers worse results. So why would we have that? Why is everybody okay with that? But that's our system. And this is what happens when you have that system, a 40% increase in premiums. During a crisis, when people need the help and need the care the most, they're going to skim on the care, the treatment, and they're going to jack up the premiums. It's almost like this story alone is an argument against the terrible system that we have. And it's almost like that because it is.